Today's session is going to discuss criminal justice and public health to address community trauma from gun violence. Two of our esteemed colleagues are in the room. We have Dr. Joe McMillan, who is a contributing faculty member for the College of Psychology and Community Service in the School of Criminal Justice. And we have Dr. Sri Banerjee, core faculty for the College of Health Sciences and Public Policy. At this point, I'm going to turn things over to Joe. Welcome, Dr. McMillan.
Good morning. Thank you very much. I'm really grateful for this opportunity for Dr. Banerjee and I to present this information to our colleagues today. Just a little bit about myself. I'm a past retired federal agent. I retired actually after about 41 and a half years back in 2018 timeframe. I've been here at Walden as a contributing faculty member now since about 2016, working in the School of Criminal Justice, teaching all of our courses at all levels from undergrad through the doctoral level. In my law enforcement public service career, one of the opportunities I had was to serve as the National Organization of Black Law Enforcement Executives National President. And in that space, and that organization was able to look into some of the things that we're going to be talking about today that really spurred the research interests that I've had with regards to juvenile and youth gun violence in our country. So I'll let Dr. Banerjee introduce himself for a few minutes, and then we'll start with the presentation.
Thank you, Dr. McMillan. I'm Dr. Sri Banerjee. I'm part of the public health program, and initially I got started in public health. Actually, I have a medical background, so I would learn about the pathophysiology of gun violence. I actually witnessed people that came to the ER from gun violence and treating patients, and eventually, unfortunately, died. So some of my initial interest came from medical school and the discipline of medicine. I transitioned into public health, and some of those interests actually solidified into exploring different avenues. And with my pairing with Dr. McMillan, I have the opportunity to able to apply some of the tenets and concepts that can cross-disciplinarily kind of go together. So we'll be talking more about that in this talk. So let's go ahead and get started here.
Yes, next slide, please. So how did we get here? And how we came together, some of the description of this session. What this session is going to do is take a look at the model known as the Cardiff model. And the Cardiff model is something that was actually introduced by the Centers for Disease Control, where it's utilizing police data and commensurate with things that are going into communities to try and get in front of the issue of violence in those communities. And I'll talk a little bit more about Cardiff when we go further down in the presentation. The next slide, please. So how do we come together? I've got several bullets up here for you to consider, but I also like when I say how we came together, what's the problem? In July of this year, I had to do a presentation regarding some of the material that you're going to be hearing today that I worked on with Dr. Banerjee. And at that time, I pulled statistics identifying what our current gun problems were in the United States using data from gun violence archives. In July, we had approximately 8,800 homicides or murders in the United States. When I pulled the numbers today, it was 14,403 murders in the United States. In July, total injuries were 16,811 people that have been victims of firearm violence. Today, there's an additional 11,000. That number is 27,648. The number of children up to age 11 in July was 122 that had been killed by gun violence. That number today sits at 204. In July, there were 308 youth or children from 0 to 11 that have been injured. Today, that number is at 475. In July, teens from ages 12 to 17, the number was 619 that had been killed in the United States. Today, that number stands at 991. In July, there were 1,739 youth teenagers between ages of 12 and 17 that had been injured. Today, there's been an additional 1,000. That number sits at 2,787. That's the problem. So how we came together was a conversation that Dr. Banerjee and I had relative to this issue. And we saw a need to leverage different disciplines and capabilities and competencies to address, as Dr. Banerjee has indicated, what is a transdisciplinary issue. Me working in this School of Criminal Justice, him working in public health, we saw the capacity and capability to take a very broad approach, if you would, of addressing this issue from using the public health model. And you'll hear us talk about the public health model frequently throughout this presentation. So there's several phases to the public health model. First off, you got to be able to define the problem. Then you got to be able to identify the risk and protective factors. Then thirdly, you need to be able to develop and test prevention strategies. And then finally, it's the widespread dissemination of identified strategies. That's the public health model, and one that we both believe and has been demonstrated through research is invaluable for dealing with sometimes what might be considered intractable, complex issues, especially issues such as gun violence. So we were able to leverage our various program knowledge and skills and abilities and look at existing domains that we might have visibility to. Dr. Banerjee looking at some public health domains, myself looking at criminal justice domains through the Bureau of Justice Statistics and other, and to bring those capabilities and resources to bear so that it's something that our students can benefit from when they're seeing how you're using a blend, if you would, of resources in their academic journeys, whether it's at the graduate, undergrad, or even the doctoral levels. That there's a variety of resources that can be on both sides of the fence, if you will, public health, criminal justice, that complement one another when you're trying to tell the full story. A lot of times we talk about the homicides in the United States, but as I also like to say, it's those injuries, those non-fatalities are just as important. When you're talking 27,000 people that might have been injured from a firearm, that's a situation where only because of God's grace and mercy, a person didn't die. So that number, you know, when I gave you the statistics a few minutes ago, when we were talking about 14,000 deaths, could very easily have been 27,000 deaths, all up to this point in time in year. And that's pretty troubling. So we were able, like I said, to identify the information, the domains that we could use to look into the problem and get into the literature, the pertinent literature that was related to this issue, and then using again and leveraging the competencies of both programs. With Dr. Banerjee, leveraging the geospatial analysis that's traditionally used on the public health side and not traditionally used on the criminal justice side, quite frankly, in looking at some of these issues. And then finally, our ability to do some outreach to professional organizations. Me on the law enforcement side, where I actually presented some of our issues at NOBLE's National Organization of Black Law Enforcement Executives annual conference back in August of this year. And then Dr. Banerjee having the ability to leverage on the public health side in his space as he's attending public health centric types of engagement. So what I try to do, and I know he does with his students, is to say that these are opportunities that you have when you're doing this type of research, when you're doing this type of investigation to issues and exploring issues, to kind of get your research, kind of get your information out there in other domains so that it's beneficial, and learning how to work across the lines, transdisciplinary, potentially, to address the issue. So that's how we came together to deal with some of the issues that we're going to discuss today. The next slide, please. Our objectives, or some might call it an agenda for the day, is going to go over our theoretical framework, which is epidemiologic criminology, as well as polarities of democracy, was the theoretical frameworks that we use for our work. We're going to talk about how we applied the social determinants of health. Well, hopefully you can see the value in how we were able to do that and going through that literature, going through the material in EpiCrim as it's known. And then finally, we're going to elaborate on this entity known as the Cardiff model. Because it's interesting that when I was doing my own dissertation research, and you can go to the next slide, I was looking for something that would help in the implementation. And I firmly believe the Cardiff model is that implementation piece that I was looking for when I was using a public health approach to looking at gun violence for my own dissertation work. So again, what we did in the research, what we've done in the material that we're pulling together thus far, is to use these combination of models collectively, okay, in it, so that and that's the benefit, because by that we could see where the weaknesses and where the strengths were in the information that we were calling out, and where we might need to go dig deeper to understand what was going on in communities. So up until that point, I frankly never would have even considered social vulnerability indices or social determinants of health as a part of the research itself. And that's something, again, for our students, that as they're dealing with some of the criminal justice issues that I see, that there's a combination of models that they might be able to use in conjunction with their theoretical or conceptual frameworks to help explore and tell the story regarding the issues that they're engaged in. The next slide, please. EpiCrim. So what is this thing, EpiCrim? EpiCrim, epidemiology criminological approach was originally developed by Doctors Akers and Lanier when they actually worked at the CDC at the time. And we're going back to actually the mid-90s when this came out. And what they were trying to do was looking for an approach that transcended both the disciplines, if you would, of public health and criminology, and that you could bridge those two approaches at the time. And as I said earlier, it's an approach that helps you get visibility to some complex issues regarding the issues of gun violence. Is not a single issue that creates gun violence in communities. And this approach of using EpiCrim provided that capacity, provided that capability to blend these two disciplines together. So we were able to get into the literature, and you can see on the screen there that identified the variety or plethora of material that connected public health and connected criminal justice disciplines, engaging individuals that are traversing, these two domain areas. There was a statistic that I saw and that I had actually in a presentation I did, that approximately 60 to 70% of violence issues are never reported to the police. And that was material that came out of some DOJ studies, and that people would show up for a variety of issues, but they're not necessarily showing up where a police officer was called, or EMS was called to transport them to the hospital. So it's a significant amount of data that was showing up on the public health side that law enforcement, frankly, had zero visibility to. And what this EpiCrim does, epidemiologic criminology, is it gets you thinking in this mode of blending of two disciplines themselves. And unfortunately, and again, as we were doing the research and I was doing my own dissertation, I found that as far back as 1988, it was suggested that this was a failure by taking single approaches of violence in communities from a criminal justice perspective, that we weren't leveraging the public health domain to help prevent injuries and death from violence. And that's as far back as 1988, even before EpiCrim became very novel as an approach to deal with this issue. Next slide, please. Next slide. So here I'm going to let Dr. Banerjee speak to social vulnerabilities indices and how we were able to utilize that with regards to our reviews. Dr. Banerjee?
Thank you, Dr. McMillan. So in terms of, we were creatively, actually, collectively kind of working on a research paper trying to meld all of these together. And we found that the social vulnerability index is important for implementation of some of these theories that Dr. McMillan and I'll be talking about. Dr. McMillan did already. So we have social determinants of health, and the Dahlgren-Whitehead model actually was there since the 70s and 80s. So some of that kind of evolved and transformed into what we know now as social determinants of health. I'm going to go over that in more detail in the subsequent slide. But in terms of the actual index, there's actually 16 US Census variables or social factors that are subdivided into 4 categories. And I'm going to show you the visual again in a subsequent slide. Local authorities identify vulnerable communities. So the idea is that if you can locate the areas that are higher in frequency or count of gun violence incidents, then you can use targeted social programs to be able to address this in areas where this is a problem. And I'm going to show you the connections between gun violence and some of the social determinants. So there's a strong association between SVI and even pediatric shootings and multiple major US cities. So one area that I wanted to talk about is why. Why is this so important to study from a social context? So traditionally, the solution has been, let's just take them and throw them in jail and then not worry about reform. The individuals, they basically, there's recidivism, reoffenders that are actually continuously returning to jail. However, this concept is that you have to understand the social factors. And this is similar to what Dr. McMillan was alluding to in his talk. So I wanted to start off in the beginning to talk about this quote. And if you have any kind of thoughts, then you can type that in the chat box. So it is vital we begin to investigate the factors causing social disruption and housing displacement, such as gentrification. And many of you probably know the term and the concept of gentrification. So very important to know in order to develop and implement targeted interventions to prevent firearm injuries. So in public health, we kind of talk about this, but to kind of marry the concept from public health and relate that to criminal justice, this is what is novel and what we are trying to pursue. So let me just visit gentrification. And this is related to gun violence, but there's social concepts that you really need to understand in order to fully grasp the issue of gun violence. So again, what is gentrification? This is poor urban area that is changed by wealthier people moving in. And if you go to any city center, you'll actually see this phenomenon. So people moving in, improving housing and attracting new businesses. So in many places, actually, the city I live in, they're redeveloping the city environment. And people say, wow, this is great development. I mean, things are coming in, and the idea is that if you increase the wealth among the rich, that will trickle down. But if you think about this, look more closely and use a public health angle, gentrification actually causes displacement of underrepresented communities because it increases the cost of living. So this is, poverty is source, right? But to understand the concepts that are underlying poverty, I mean, you can't just look at poverty and make relationships with gun violence. You have to dig much deeper. And that is what I'm asking you to do as we deliver this talk. Next slide, please. All right, so here are the overall vulnerabilities. Interesting insight type of index. The overall vulnerabilities, these are 4 themes. They're called themes. And one is socioeconomic status. So as you can see, kind of corroborating what I was telling you previously in a previous slide, we have to go beyond the surface and really dig deeper. So poverty is one of them, but you have to understand unemployment, even gentrification, housing cost burden. Of course, that goes into that. No, education, no high school diploma, no health insurance, and that's tragic because these are sources that are creating the conditions for gun violence to occur. So we're trying to address those, and that's the area that we're trying to hone in on. Household characteristics, age 65 and older, what is the percentage? And the idea behind gun violence, we actually found in original research that people that are age 65 and older, they're not really having as big a frequency of gun violence as people that are younger. So younger people are more affected by gun violence. Children with disability, single parent households, English language proficiency. So maybe the individuals are not acculturated with the environment, and so kind of loss in community resilience. Racial and ethnic minority, there's quite a few looking at some of those areas, and actually our research showed that there was a really high sort of relationship between the two. So, and then finally, the housing type and transportation. So these are self-explanatory. I mean, if you have no vehicle, then you're not able to, this creates the condition, the perfect storm for gun violence to occur. Next slide, please. All right, so all of you, if you don't know, then you should know. There are 5 domains, and many of us have actually been kind of promulgating some of these ideas. But there's 5 domains, and there's education, access, and quality, healthcare and quality, neighborhood and built environment, social and community context, and economic stability. So these are very broad. Sometimes students will say, I'm going to apply social determinants of health to this concept. Well, these are very broad. So for instance, under economic stability, you have food insecurity. So they're umbrella domains. But what I want to describe to you here is that how you can apply this is that what are the risk factors for using social determinants of health? What are the risk factors of the occurrence of gun violence? So one of the big things that, of course, came to surface was poverty. Areas with the highest poverty rates experience the most gun-related deaths. This is from research. I'm not just telling you this. Actually, a study found that young people in counties with the highest poverty levels were more than 4 times more likely to die from gun violence than those in counties with the lowest poverty. And as soon as you're talking about counties, this is where geospatial comes in, because you can really go in, law enforcement can really go in and say, this is the area we need to create programs for, this is the area and we need to provide funding. And I'm going to, we're going to talk about some of the research that pertains to that. Minority status, linked to minority status, gun violence, but not all disadvantaged neighborhoods experience high levels of gun violence. So this is not a overall overarching sort of conclusion. And then underground gun market. So you have underground gun market that can make income communities vulnerable to gun violence. So from commercial interests, many high-risk individuals are equipped with guns. And more importantly, there's so much inconsistency between states. So for instance, California has very strict gun violence laws. So the idea is that people use illegal means, and that actually allows for more gun violence, is that people will use illegal means to transport guns from less stringent states to more stringent states. So there's a lot going on, and I'm going to be going over some of this in subsequent slides. Next slide, please. All right, so I kind of went over this. There's a crosstalk between social determinants of health and criminology, criminal justice. One specific resource, if you're kind of looking to do original research in this area, then what I really urge you to do is look at the CDC places database and just Google that. You'll be able to find that. Places stands for population level analysis and community estimates. And believe it or not, this actually includes 9 SDoH measures from the American Community Survey. So you'll see some of these theories kind of clash, but you're able to kind of make sense. Like we decided that we were going to stick with SVIs. So this is a way to typify. I'm sure many of you have heard of Healthy People 2030. These are goals, and there are some gun violence related goals. Not very thorough, and I've actually appealed to the CDC to include certain objectives. There's 359 objectives, but in our opinion, Healthy People 2030 should include more gun violence. If you don't have any goals, then how will you achieve them? If you don't know what you have to achieve, then you'll never get there. So this actually makes sense. So I went over the risk factors of gun violence. Now the impact, right? So there's mental health problems. Very important to talk about when you're talking about gun violence. The trauma that comes about when a gun violence incident takes place is really tremendous. And many adults lack the knowledge to help children and youth who are struggling. I mean, keep in mind, Dr. McMillan started with this. He talked about how children are affected, and this is something important to note. Adverse health outcomes and then social adversities.
Let me throw
children-
one thing in here if I can, Dr.
Yeah,
Ben.
go ahead.
In this space, as we're talking about gun violence, and traditionally, like I say, a lot of times we talk about the homicides and injuries, but there's another number that should be as poignant in our brain cells, and that's the suicide rate. And it's a suicide rate also for youth, okay, which is again very high. So by using these types of strategies, again, whether it's for research to add to the body of learning, if you would, in this area, that's an area that that both Dr. Banerjee and I expect to kind of expand this towards, because that suicide piece, that mental health piece, that he was just speaking to is a component that's often forgotten. And I'll also throw out another area when you're talking about the domains of social determinants of health and criminal justice. A lot of times we focus on urban areas. It's just as much as a problem in rural areas. And that's an area that's actually, quite frankly, under research. So if you've got students that are interested in using these types of approaches to their researches, they would find that there's a significant gap of research as it relates with gun violence in youth in rural areas. So I just want to put that out since you were speaking briefly about mental health aspects. Thank you.
Yeah, that's a great point, Dr. McMillan. So this is not only there's urban health, there's rural health, and some of those areas encapsulate the connections. So these are kind of the main areas that relate to and frankly relates criminal justice to public health. That I hope between the two of us, you're already able to kind of see the connections, and we'll try to bind the two more as we go along. Next slide, please. All right, this Dr. McMillan.
We're going to speak now on this Cardiff model. And what I want you to understand is this toolkit is actually on the CDC's website. They actually partnered, and you'll see that in the next slide, with Dr. Shepherd, who's the originator of Cardiff. It started in Cardiff, Wales. And what it does is it provides guidance. There's not mandates with regards to Cardiff. A lot of times communities or public sector entities, they don't want people mandating that they do something. So what this does is it provides a strategy, if you would, for both hospital information, because I saw in my own research, sometimes what's thrown up is, well, they're HIPAA violations. You can't share information. Well, if I have public health entities involved with the police department with regards to this, and information's anonymous with regards to the specifics, some of the specifics in there. Yes, it can be shared across those domains. So it's just a matter of how it goes about. So what Cardiff does, it literally provides templates for the hospitals, law enforcement, the legal and financial consideration that need to be there. And it's all geared towards building these partnerships and the relationships. A lot of times in law enforcement, we'll say the time to engage with an entity that you've never engaged with before is not when the incident happens, but it's before. I can personally attest to that. Just going back from my own law enforcement career, we've spent a lot of time and a lot of energy and effort in building relationships before the balloon went up, so that as that incident transpired, you knew exactly who to go to, who the decision makers were. And what Cardiff does, it helps communities in this communications aspect, in bringing everybody together and making sure that you've got the right memorandums of understandings, you've got the right things in place before an incident transpires, so that you can get out in front of the violence issues themselves. A lot of communities, and you can go to the next slide, as I've been going around the country, quite frankly, in different forums on the law enforcement side, speaking about Cardiff, I'll start out very quickly saying, how many of you have even heard of Cardiff before? So like literally, I was in a room with about 100 professionals at the local, state, and federal level. I'm in August of this year, and I asked that question, and traditionally, I may only have less than 5 or 6 hands raised up in that audience. And so there's actually a network. It's called the Cardiff Network. Right now in the United States, there's only really 16 cities that are implementing. Some very large municipalities, like down in the Atlanta area, is one. Out in Milwaukee area, there's another part, Reno, I'm sorry, Las Vegas, Nevada. So you've got these pockets around the country where people, practitioners, are coming together on the public health side, and they're coming together on the law enforcement criminal justice side to say, what can we do to help ameliorate violence in our communities? And what this does is it gives an ability to see the value. So you can see on the slide, there was a 32% reduction when Dr. Shepard was to use this model in the United States and look at comparative analysis of assaults in the United States. Using the model, the results of 32% reduction when it had in fact been implemented. 42% in hospital admissions. Okay, so you're seeing the efficacy, if you would, and the value of the utilization of this toolkit. Like I said, it's literally a tool. I'm showing it, and we'll have the links for the resources at the end of this presentation. But this is literally something else in the tool belt that public health, law enforcement, community advocates can use to help, in addition to focused deterrence and other strategies that might be utilized to try and get out in front of violence in those communities. Placing something like this in the toolkit gives additional visibility. It gives you additional finger on the pulse relative to the problem of violence in those communities. So by having Dr. Shepard come in and do some comparative analysis as to what had transpired over in Cardiff, Wales, again, like I said earlier, you can see some of the benefits, fiscal benefits to communities when you're saving money, okay, with regards to the costs. I mean, the criminal justice apparatus is a multi-billion-dollar apparatus, throughout the United States. And if you can save costs in there, you can save healthcare costs, you can save penal costs, that's a value add. And so what I've been trying to do personally, and with the help of Dr. Banerjee, as we've been doing our look at exploring this issue, is to sensitize and make more people cognizant of the Cardiff model. And I'm just curious, prior to this presentation, if you can just throw it in the chat, yes or no, how many of you were even cognizant or even heard about the Cardiff model? okay, that the United States uses and promotes through the CDC? Just throw it in the chat. Yes, if you have, if you haven't, just quickly so we can get some sort of indication from some of the colleagues that we have on the line right now. The next slide, please. So, Dr. Banerjee, you want to talk about some of the geospatial applications
Mhm.
and what we
Yeah, sure.
found, some of the results that we had.
So couple points I wanted to kind of make is one, once you have a gun violence incidence, and this is kind of a public health perspective as well. I'm actually in the criminal justice program taking courses currently, and transitioning from the talking two types of languages and kind of melding that into one. Dr. McMillan from the criminal justice side and me from public health, the language intersection of the language was especially important. Public health is all about prevention. If the gun incident has taken place, you're too late. How do you kind of join everything? And one of my degrees is in geospatial research. So how are ways that we can kind of use this geospatial concept to better understand gun violence? So think about a city, and we've been kind of talking about this for over a year. Think about a city and the locations within the city. I mean, you have the county level location, and this is a very important concept because um, anyone can say, all right, nationally, there's 30,000 people that die from gun violence or incidents. But the question is, where are these gun violence incidents taking place? I mean, nationally, you can say anything, but can you say that in Los Angeles, this is what is taking place? Can you say that in Atlanta, this is what is taking place? Well, you can say that in Georgia or in California, but that is not something that lawmakers can make use of. So you go into more granular sort of levels. So you start thinking about counties. Now, when you're trying to look inside a county, a lot of times the cities have, and we actually did this, we were talking about using counties. But the problem is when you're using counties, I mean, cities are comprised of maybe two counties. You can't, I mean, n equals 2, you can't really do much from that. So we have to kind of hone in even further. So you go into zip codes and something else called census tracts. You might not be familiar with census tracts, so I'm not going to go into that. But zip codes really give you the location, the area that there's higher incidence of gun violence. So we in some of the original research that's in press currently, and we're going through the revisions, we found that there were certain areas that were higher incidence, and we were able to kind of relate that within cities. And so merging data sets. So we didn't have information about some of the social characteristics. Like we didn't have information as much about socioeconomic status, of the gun violence incidents, like people living there. So what we had to do is merge zip code level data with these points to understand if in this area, what is the socioeconomic status of the people, and kind of translate that to, and I know this is kind of, using some inferential statistics, but going in and saying that people living in this area have this certain socioeconomic status. From that, you can actually create models that relate some of these concepts into gun violent incidents. And we actually used Poisson regression to relate some of these incidents. And Poisson regression is commonplace in geospatial analysis. So I hope this has given you kind of a flavor of how geospatial concepts work, and how this really pairs well with criminal justice. So geospatial studies are something that really the whole university can benefit from, because this is an important application. Next slide, please.
I want to say something very quickly on that point.
Yeah, go.
The area of geospatial analysis is one that I've even suggested within our program in the criminal justice side, that's a course that I think our students on the criminal justice side would truly benefit from. And I know as we look at doing other things within the program, hopefully that will be an area that we might be able to offer cross-disciplinary wise within our school, between the two schools, that even if it's taken as an elective by the students. So I think that course would be one extremely beneficial, especially as the students and as you as faculty members are able to help promote these types of concepts and ideas in them, that this is something that they would benefit from in helping to tell the story about their research, because it would have been very helpful for me, frankly, when I did my own research, my own dissertation, had I been utilizing some of those types of techniques and tools and with regards to the research that I did on gun violence. And I think these courses like that are definitely beneficial between the two programs. Sorry, go ahead.
No, thank you, Dr. McMillan. Basically, and Dr. McMillan, you can add
Yeah, I can go.
to what I'm
Yeah.
about to say.
These slides here, what's in it for our students. We kind of talked about it, that this, gives them a lens and visibility, is what both Dr. Banerjee and I can speak to in our classes, and that it's exposing them to transdisciplinary research a lot of times. And that's something that I know as an institution that we're beginning to promote even more, and it helps develop their skills much stronger as researchers on the issues that they're dealing with. So again, when you look at a variety of the topics, I can speak on the criminal justice side that we might have students explore. There's probably a parallel capacity on the public health side as a part of that qualitative, that quantitative study that they may be even engaging in the doctoral level. So it gives them that ability to learn about other relevant issues. Like I said, when epicrim itself as a discipline was not just looking at violence, it looked at a variety of issues that covered the criminal justice domain itself, from incarceration, okay, down to incarceration rates in penal institutions, and how public health might be a factor with regards to some of those issues. So that's what's in it for our students. It opens up their minds. It opens up their capacity to think that, how can I leverage this resource? How can I leverage that's being used by a totally different program that I really up to that point had not been exposed to. But the more, you have colleagues like Dr. Banerjee willing to open up, with regards to what they're doing, I'd say even on the law enforcement side, open up and pull up the kimono, kind of speaks that these are the kind of things that we're doing and how we can benefit from one another. It helps communities and it helps our students collectively and individually with regards to the research that they're doing. Anything you want to add to that, Dr. Banerjee, before we go to the next slide?
Well, I mean, I kind of wanted to say that in terms of gun violence, this is something, I mean, so the public health approach has really been emphasized, and Dr. McMillan and I were actually talking about this multiple times. And so it only makes sense, the marriage of the two disciplines, that is the logical sort of solution here. And so I'm sure some of you actually read about this. This U.S. Surgeon General, Vivek Murthy, actually this year made a declaration that gun violence is a public health crisis. So there is no question. I mean, people will say, well, I mean, you got to keep these disciplines siloed in order to explore things effectively. But this statement really brings home the fact that we have to consider social problems from multiple perspectives. Previously, Theresa May, the Prime Minister of the UK, had said the same thing. So this is not only the consensus here in the United States, this is the common consensus in different countries. So why aren't we doing this more? I mean, why aren't we bringing the stakeholders to the table and saying, well, here's your discipline, here's your discipline. Let's go to psychology, here's your discipline. Let's talk together. Why isn't this happening? I mean, this is a logical sort of result of this huge problem. I mean, even mass shootings, we're not really going into that, but these have really taken, almost seemingly, we see this perhaps weekly. There was a incident of a 14-year-old in Atlanta that opened fire in a school, and there was mental health problems that people identified on the previous year. So these are all examples of why aren't we doing more? Why aren't we bringing stakeholders to the table? And this is food for thought.
You know, to echo that, this helps for me from a law enforcement criminal justice standpoint, get to the root cause of the issues using the public health approach. And again, I saw that in my own research. There's a gap there in that we're trying to, that unless you engage and leverage the two disciplines together, you're really not getting to the root cause. Because as we've stated over and over and over again in this presentation, there's no one single issue or factor for gun violence. It's a multiple myriad of intractable issues that are occurring in communities that cause gun violence. So if you're taking a siloed approach to it, a tactical approach to it, and vice a strategic approach, you never really get to that root cause. And that's what marrying these two disciplines helps to do as it relates to this violation. And again, I hypothesize for other violations, as is shown in epidemiologic criminology, that using this approach helps you address a variety of things that are occurring from a criminal justice standpoint. So it's just like Dr. Banner said, it makes sense not to be siloed. On the law enforcement side in our academies, you're not taught about the public health problem for the most part. And again, I saw that in my research on the public health side, they're not taught about a variety of the strategies that's utilized on the law enforcement side to do this. But so that siloed approach occurs academically at the institutional levels. And this is an opportunity, and for Walden and others to be very forward leaning to say, no, we can do better. And by doing better, we're helping communities. We're helping to ameliorate and get in front of the issue, vice being, reactive to the issue, because we're using the tools from the two disciplines for this issue. You can probably throw the next slide so we don't run out of time. We got about 7 minutes. We can go through this. These are some of the resources, the toolkits that are there, in our presentation that you're more than welcome to do. I think Dr. Banerjee, you wanted to do that one slide presentation.
Well,
it's your.
do you want to return to that if we have time? I just want to make sure we wrap things up in a proper way.
Well, why don't we go see if there's you can go to the next slide. I think it's the Q&A actually. Is the slide after this. It's just our references.
All right.
Yeah, it's our references and then the Q&A.
Yeah, we can then play the video.
Yeah, if you can play that video, Ms. Downs, we appreciate it real quick.
Dr. Sri Banerjee, epidemiologist, biostatistician, faculty member. And in this segment, I'm going to be going over a data set that I actually haven't gone over previously. I've talked about BRFSS, NHANES, NHIS, but this is actually a data set that is unique in the fact that there's pregnancy. So this was kind of going into additional data sets that you can look at in order to look at adverse childhood effects and how that influences gun violence. So I don't want to necessarily go into this too deeply because I want to make sure we are able to wrap things up. Collaboration is important. I mean, research collaborations, they're of tantamount importance. Thinking about this, so why is this such a problem in the United States? It seems like people and our policymakers don't make any changes, make any major changes. You have all this gun violence going on. You have all these mass shootings going on. Why is there no change? So, I can just say this is the political climate, but this goes well beyond that. So, people that are more individualistic or have, kind of right-leaning ideas, they and everyone in the U.S. The Second Amendment to the United States Constitution guarantees the right to bear arms, and a lot of people that you probably talk to have that same mentality. About a third of the US adults say they personally own a gun. There are countries where guns are outlawed. So why aren't we making everything stringent? I told you previously that California has very stringent gun laws, whereas in Georgia there aren't. So these guns get shipped to more stricter gun law places anyway. So why the restrictions? I mean, doesn't work. So at the same time, in response to concerns such as rising gun death rates and mass shootings, the U.S. So that's why there was a declaration, and that's why that was so important. So a lot of things that we were talking about, just to revisit some of the questions, what barriers still exist that prohibit solutions from being effective in low-income communities in gun violence? I hope you've kind of gotten the message here. I mean, the barriers still exist because of policymakers. Barriers still exist because people don't recognize and understand the public health perspective, criminal justice perspective. There's a deeper understanding that is required to be able to see the gamut of problems that are out there. Dr.
So,
McMillan,
we did that short survey. I asked about Cardiff before. 40% of the participants in this program had heard it. We had 5 people that responded to the survey. It was like 60% had not, So it's about promoting, it's about getting out in the communities and making people more aware. It's about ensuring that your students are cognizant of these issues. And that's why we wanted to present this, in this type of a forum, to give additional lenses to the faculty, helping to promote these concepts to your students, don't be afraid to use other data sets outside of your normal disciplines. Don't be afraid to have conversations and communicate with people outside of your industry or your discipline. I did that as a part of my own research, where I had the public health doctors and surgeons that I interviewed, as well as the chiefs of police, assistant chiefs of police, just to get an understanding about the issue. And using those blended approaches is really very advantageous. So we are both very appreciative that you've given us an opportunity just to share with you today some of the areas, and we don't have all the answers. We're doing additional research in this area, but through the collaboration, and I believe very strongly in collaboration and through the support of institutions like Walden's to support collaborations like this, that's where the message gets out into the broader community. So when we presented our own individual conferences and things like that, they hear about how Walden students and how Walden faculty are trying to be forward-leaning for positive social change, especially on an issue like this, that's really very present within our community today. So again, thank you very much for giving us this opportunity today.
Thank you, everyone.
Thank you. And if we have any last minute questions, we have about 1 minute left.
Not a question, but just exhorting you to present outside of Walden. It's great that we are presenting here, but I would love for us to just be a catalyst and get the word out.
Thank you.
Thank you.
Thank you.
Great. Well, thank you all. If you have any questions about today's session, certainly you can reach out to our fabulous presenters. If not, you can also reach out to OTLE about any upcoming or even previous sessions. We are recording today's session, so a copy of this recording will be housed in Commons, but also on the OAA and OTLE websites. I want to thank you all for attending, and most definitely thank you for our presenters for carving out time to share this information with us. I hope you all have a wonderful rest of your day.
Thank you.
Thank you.